Assalamu alaikum, students. My name is Dr. Ashaq Hussain, and I am an assistant professor at Rashid Latif Medical College, Lahore, Pakistan. In this video, I'm going to talk about the diaphragm, its diaphragmatic attachments, and its major openings through which different structures pass. So, diaphragm is a muscular tendinous structure. As we can see from the inferior view, the central portion which you can view is the tendinous portion, and here, and whereas its peripheral portion here, which you can see, is the muscular part of the diaphragm. So again, from here you can see this is tendinous portion, this is surrounding portion is the muscular part. So diaphragm is a dome shaped structure. As you can see, it basically divides the thoracic cavity from the abdominal cavity. Thoracic cavity lies above the diaphragm and abdominal cavity lies below the diaphragm. So diaphragm has got two domes, right dome and left dome. Right dome is bit higher as compared to the left dome. The right dome reaches at the level of the fifth costal cartilage, whereas the left dome reaches at the level of the fifth intercostal space. And why it is so? Just beneath the right diaphragm we have got a liver which is pushing it upwards, and whereas on the left dome of the diaphragm we have got heart above it, and which is pushing it down. So again, this diaphragm, it has been divided into different parts depending upon the which part is originating from which surrounding bone. So this anterior part, this is also called the sternal part. It is originating from the sternum. As you can see that two slips, they are getting attached onto the posterior surface of the Z5 process. So here lies the space of Larry, from where internal thoracic artery, when it passes down the thoracic cavity and divides into musculophrenic part and superior epigastric, it actually passes through this opening. And this portion is not always present. Sometimes it is missing and resulting in Morgagni hernia. And on the lateral side, either this on either side, this lateral part is attached onto the costal cartilages of the 7, 8, 9, 10th costal cartilages, and their adjoining ribs as well. So this portion is called costal portion. So again, sternal portion and costal portion. And this posterior portion, it is also called lumbar portion. Why? Because this posterior portion is originating from the vertebral bodies of the lumbar vertebrae. So here we have got two crura. This is right crus of the diaphragm, this is left crus of the diaphragm. Right crus, you can see it is longer as compared to the left one. It is originating from the upper four lumbar vertebral bodies, and this is originating from the upper three lumbar vertebral bodies. So these two crura, they are joined together at median arcuate ligament, and as a result opening is formed, and this opening is called osteoaponeurotic opening, through which aorta passes at the level of the T12. Aorta passes at the level of the T12, and along with the aorta, two other structures they do pass. Number two is azygous vein or hemiazygous vein, and number three is thoracic duct. So I always, to remember these structures, I always try to give them color coding. Aorta is red in color. One other color was blue, which is a vein, and that vein is azygous vein. And third one is the thoracic duct, which is shown green in color in the different atlases. So actually three colors, they actually pass through this opening. And look at this opening. This is osteoaponeurotic in nature. Why osteoaponeurotic in nature? Because posteriorly it is bounded by the bones, osteo, and anteriorly it is bound by that tendinous part or aponeurotic part. Because nature wants aorta to be always patent, because we know that this diaphragm is the chief inspiratory muscle, so it is in a constant state of relaxation and contraction. If aorta would have been passing from some other opening, like this muscular portion which is surrounded by all muscles, so aorta would have been constricted or compressed on each inspiration. So as a result, the blood supply to the lower portion of the body would have been hampered. So nature has put aorta into the osteoepineurotic open, which is patent all the time, no matter what is the situation with the diaphragm. Whereas this second opening, which is muscular in portion, in nature, here we can see that the esophagus passes through it at T10 level. So if this muscular portion surrounding the esophagus even constrict, it doesn't cause any problem to the esophagus, because esophagus lower end is connected to the stomach. So here this muscular portion is acting as a sphincter. So it is compressing the gastroesophageal sphincter and preventing the gastric contents to reflux into the esophagus. So in old age, as a result of generalized laxity of the skeletal muscles in the body, this muscular portion is no longer in a position to act as a sphincter and compress the gastroesophageal as a result, gastroesophageal reflux disease, which is called GERD, it develops. So this esophagus, along with the right and left vagal trunks, which are going to supply the stomach. So esophagus is connected with the stomach. So right and left gastric trunks, vagal trunks, they prefer the esophageal opening to pass through and reach the stomach. And beside that, another celiac trunk has a left gastric artery. Its esophageal branches, they do pass this opening as well. And then here comes and this opening is lying at the T10 level. And then at T8 level, we have got in the central tendon, we have got inferior vena cava, and this inferior vena cava allows this opening is tendinous in nature and allows the inferior vena cava and right phrenic nerve to pass through it. And then we have got two other. This is median arcuate ligament, as we have already discussed. This is the medial arcuate ligament, which is present between the vertebral body and the tip of the 12th thoracic vertebra, and from tip of the 12th thoracic vertebra till the tip of the 12th rib, here lies the lateral arcuate ligament. So three arcuate ligament: median arcuate ligament, medial arcuate ligament, and lateral arcuate ligament. And these two lateral and medial arcuate ligaments are formed by the thickening of the fascias of psoas major and quadratus lumborum muscle. Their upper portion gets thickened to form these arcuate ligaments. So this was brief about the diaphragm, muscular attachment and their opening. And in next video I would talk about the blood supply and nerve supply of the diaphragm as well. Thank you very much.